Hi, I'm Dr. Amy Doneen, and I'm the co-founder of the Bale Doneen method.
I'm Dr. Bradley Bale, co-founder of the Bale Doneen method, and our method is a process by which we evaluate and treat individual patients, and it's effective to the point that we guarantee they will not have a heart attack or stroke.
Yes, and we've had 2 publications now that demonstrate that the Bale Doneen method identifies, stabilizes, and regresses atherosclerosis. We talk about our method in our book called Beat the Heart Attack Gene, where we focus on the genetics and the inflammatory story associated with atherosclerosis, or plaque in the arteries.
Yeah, it really is an exciting time that we live in now, where we can actually guarantee people will not have heart attacks. That's still the #1 killer in this country and has been since 1900. So everybody should be very excited that we now have a method, a process, whereby we can guarantee people won't suffer those heart attacks.
We spent a long time evaluating the root causes of vascular inflammation, which there are many. The problem is the standard of care often focuses on 2, one called cholesterol and one called blood pressure. And what we've learned over the last 15, 17 years is that there are many other root causes of vascular inflammation. Things like periodontal pathogens, things like endodontic disease, also tricky things like insulin resistance, genetically inherited lipid abnormalities, even the gut health has to do with vascular inflammation. So what we've done is we've identified root causes of atherosclerosis or vascular inflammation, identified those root causes, treated them, and see the patient live a life free of cardiovascular disease.
Yeah, and it's exciting that we have simple biomarkers, literally urine tests and blood tests, that we can evaluate on an individual patient that tells us if they're inflamed or not with their arteries. So those biomarkers are critical and something that we monitor all the time to make sure we have extinguished the fire, so to speak, in the arteries, and that it continues to be extinguished. We do maintain vigilance over that.
We do, and our other focus is really genetics. We focus on genetics to understand how an individual may be at a lifetime risk for certain disease states, and we set screening guidelines based on those genetics. And one very exciting opportunity to really be precise in our individualized care is using pharmacogenetics, where we can understand someone's risk as far as an adverse drug reaction and how drugs interact together, both prescription medications and supplements. So our ability to focus in on the individual patient has allowed us to really hone in on what's needed for that individual and optimize their health for a lifetime.
Yeah, and those kind of buzzwords that we're talking about, inflammation, precision healthcare, personalized healthcare, they're all hitting the mainstream media now, because that type of care is essential in achieving superb results with the individual patient. So it's exciting to see the science that we've been basing our method on for over a decade continues to just be more and more confirmed.
Yeah, and one of the key elements that we look at with our patients is the presence of atherosclerosis, or plaque in the artery wall. The current standard of care often waits until someone's had a heart attack to even know they have risk. Matter of fact, 64% of women who die of a cardiovascular event didn't even know that they had plaque in the artery wall. So we have long embraced tools and technology that are very cost-effective, very safe, non-invasive, to look for plaque in the artery wall. And then we very simply ask ourselves, why is it there? We treat the why, we see the inflammation go down, and we see the disease stabilize.
Yeah, and our method is holistic because so many things can cause inflammation of the artery, and that's why Dr. Doneen and I partner with other healthcare providers. We could not guarantee our results without having excellent dental partners. as one of the most common causes of inflammation in the artery is periodontal disease due to high-risk pathogens. In addition to that, endodontic disease, or when a tooth gets infected, can cause enough inflammation that can literally trigger a heart attack. Well, Dr. Doneen and I are not dentists. We have to have great dental providers on the same page with the knowledge standing right beside us. Without that, there's no way we would guarantee our work.
Yeah, that's an excellent point, and we're especially excited about a new center in Central Ohio. It's called the Heart Attack and Stroke Prevention Center of Central Ohio, and it's led by two thought leaders in this country. Dr. Barb McClatchy is a dentist who really gets it. She understands how her work saves lives, and she's in partnership with a cardiologist who's been in traditional cardiology for over 30 years, and he has completely transformed his practice to prevention, and his name is Dr. Eric Goulder. So the two of these great individuals have come together to open the very first center in the country that under one roof you can get optimal dental care and optimal prevention care, all leading to a guarantee against heart attacks and ischemic strokes. It's very exciting what they've done.
Yeah, every community in Ohio should be celebrating the opening of this center. Everyone in this state now has the opportunity to avoid ever suffering a heart attack or stroke, or certainly if you've been unfortunate and already had a heart attack or stroke, you want to get into this center so that you don't have another one. The recidivism with heart attack and stroke is ridiculous. It's about a third of all of those events are occurring in people who've already had one or more heart attacks or strokes. So if somebody's already had an event, for goodness sake, they want to get to this excellent center that just opened up. I kind of like to say, knowing that this kind of care is here, if you don't take advantage of it, shame on you. They're giving you the opportunity to avoid it. Heart attacks are optional. It's not a destiny type of an event. So it's exciting that they're here and have this wonderful center where they can offer this type of care.
It is, and their goal is to work in partnership with the patient's existing primary care, internal medicine provider, and also work in partnership with their cardiologist and work in partnership with their current dentist as well. What they offer goes beyond the standard of care. So they're not here to remove patients from their current healthcare providers, but what they do is something extremely unique, and that is offer the most advanced testing to identify an individual's inflammatory risk and uncover all the roots associated with vascular disease. So as Dr. Bale mentioned, patients who've already had a heart attack that are under the excellent care of their cardiologist and primary care, they're probably receiving some of the best standard of care that's available in Ohio. And what Dr. Eric Goulder and Dr. Barb McClatchy are offering is the ability to go beyond that and say we can do more and we can assist you in the optimal care of your patient.